Jai Hind and welcome back to my channel Med Talks with Roshni, and without wasting much time, let me directly come to the point. Today's question and answers is going to be from the topic disaster, emergency and critical care management. These points are just a few from a very vast syllabus, yet a must to know for all the nursing, medical, paramedic students. So without wasting much time, take out your copy and pen and let's get started. Let's begin with the first question. The most important response in Glasgow Coma Scale are options: number A, motor response, number B, verbal response, number C, eye response, and number D, all are equally important. The answer to the first question is option number C, eye response. Yes, eye response is the most important response in Glasgow Coma Scale. Moving on to question number 2. Many a times the nurse uses the word TO in short in the patient's treatment sheet. According to the nurse, what is the full form of the letters T and O? Options are number A, typing order, B, telephonic order, C, transport order, and number D, treatment order. Answer to our second question is option number B, telephonic order. Our third question: according to the Indian Nursing Council, what is the ideal nurse-patient ratio in an ICU ward? Options are number A, 1:3, number B, 1:5, number C, 1:1, and number D, 1:10. Our answer will be option number C, 1:1. That is, in an ICU ward, 1:1 is the ratio of the nurse-patient according to the INC. Our fourth question: from the following, what are the purposes of giving first aid? Options are number A, save and promote life, B, prevent worsening of the casualty's condition, number C, make the casualty as comfortable as possible, and number D, all of the above. The answer to our question is quite easy and very well known. It is option number D, all of the above. Moving on to question number 5. From the following, which item is not present in the first aid kit? So the options are number A, bandages of various types, number B, scissors, number C, cotton and gauze pieces, and number D, vaginal speculum. Here too the answer is quite reasonable. It is option number D, vaginal speculum. Our question number 6. Human body is compared to which type of machine? Options are number A, robot, number B, computer, number C, well-oiled machine, and number D, electronic machine. The answer has to be option number C, well-oiled machine. Yes, our body is compared to a well-oiled machine. 7th question. When a first aider gives first aid to a patient, which findings during an assessment is to be noted? Options are number A, pulse and breathing, number B, pallor and cyanosis, number C, bleeding and swelling, and number D, all of the above. Since options A, B, and C are the necessary findings during an assessment, therefore the answer will be option number D, all of the above. On to question number 8. In a patient with shock, the first aider should not perform this intervention. Options are number A, give alcohol, B, let smoke, C, give thing by mouth, and number D, all of the above. Well, the answer is quite simple, as options A, B, and C are not allowed. Therefore, the answer to your question will be option number D, all of the above. Point number 9. Full form of BLS. Options are number A, basic living supply, number B, basic life support, number C, believe lie statement, and number D, none of these. The answer to our question is option number B, basic life support. Next, question number 10. In an emergency patient with bleeding, what are the signs and symptoms expected? Options are number A, hypotension, number B, hypoxia, number C, tachycardia, and number D, all of the above. Since in a patient with bleeding, hypotension, hypoxia and tachycardia are all seen, the answer to our question will be option number D, all of the above. Moving on to question number 11. What are the clinical findings in a patient with anaphylactic shock? Options are number A, hyperventilation, number B, shock, number C, tachycardia, number D, nausea and vomiting. So the clinical finding in a patient with anaphylactic shock is option number A, hyperventilation. Question number 12. From the following, which point does not comes under the functions in dressing? Options are number A, control bleeding, number B, increase infection, number C, prevent further injury, number D, helpful in curing wound. The function which does not comes under dressing is option number B, to increase infection. Question number 13. Which among the following is not the purpose of wound care? Options are number A, to prevent infection, number B, to promote healing process, number C, to decrease the function of the part, number D, to absorb inflammatory exudate and to promote drainage. While reading the question again, please note the word not in the sentence. So, the point which is not the purpose of wound care is option number C, to decrease the function of the part. Moving on to our second last question. T-bandage is used in which part of the body while dressing? Options are number A, dressing of the head, number B, dressing of the abdomen, number C, rectal and perineal dressing, number D, fracture of the clavicle. The answer to our question is option number C, rectal and perineal dressing. Our last question, number 15. What is the main purpose of a stretcher? Options are number A, for patient to lie down, number B, for patient to sit, number C, to shift patient to a safe place like hospital, ambulance, and number D, all of the above. So the main purpose of a stretcher is the answer option number C, to shift patient to a safe place like hospital or ambulance. I believe these questions will help you further in your exams. Meeting you soon with another educative video like this. Thank you.